This is the iADS Member Spotlight, and today we're speaking with Dr. Peter Moy. Dr. Moy, welcome to the program.
Thank you.
So let me just ask you a few questions, if you could. I'm sure that just about everybody knows you or knows your background, but just for the record, tell us a little bit about your background, where you did your training, and then how you ended up where you are now.
All right, I'll try to do that. I grew up in Pittsburgh, went to the University of Pittsburgh Dental School. After graduation, I completed a one-year residency in hospital dentistry in Honolulu, Hawaii. Very difficult. And then I did my oral surgery training at UCLA at the Ronald Reagan Hospital Center.
And then nowadays, what are you doing on a daily basis? What are your professional duties nowadays?
Currently, I'm the endowed chair in surgical implant dentistry at UCLA. And I was fortunate the previous dean there allowed me to hold this position on a 50% basis so that I can maintain a private practice as well. And so I have the best of both worlds.
So nowadays, you've done so much over the years, but what are your strong professional interests nowadays?
It's still the same. I have a very special interest in implant dentistry, of course, with a focus on regeneration of both hard and soft tissues. My other interest really is in education. And so I have been involved with training and education since 1983. And so most of my time, if not spent in clinical practice, is for teaching purposes.
So let me ask you this. Where do you see oral surgery going over the next few years, and where do you see the dental profession going?
That's a very interesting question, David, because I really think that we are in unprecedented times today, especially with the pandemic that we're dealing with. It is really testing the resolve of all healthcare professionals. And where I think our specialties are going is more towards a higher degree of specialization. And in a way that is good, in a way that is bad, because, when I first learned implant dentistry, it was from Professor P.I. Bronnemark. And he was of the mindset that the approach for implant dentistry should be interdisciplinary. And unfortunately, I am seeing the exact reverse currently, where our general practitioners are doing more and more of the specialty work. And I see vice versa as well, more of the specialists trying to perform more of the general procedures. And so we are essentially turning our backs on this interdisciplinary approach. And I think that's wrong. I really agree with this kind of an approach where we work with all of our specialists involved in the total treatment care of a patient, whether it be for implants or crown and bridge or periodontics or endodontics. I really think that you can be the jack of all trades, but then you don't master anything. And for the sake of our patient, I really think that we should focus on the specific areas that we are trained in and are performing at our best. And so I really think that, unfortunately, not just in dentistry, but in all of healthcare, everyone is trying to do everything. And that's not, I think, in the best interest of our patients.
That brings us right back to the iADS organization. So maybe you can talk a little bit about your interest in iADS, your participation in iADS. It's a new organization, but it sounds as though from what you're saying, it's very timely.
It is. First off, I want to thank Dr. Alan Farber for his vision in developing iADS, specifically to bring back this interdisciplinary interplay that is occurring. The reason why I belong really is to gain experience, knowledge, and ideas from my colleagues from all of the different specialties in dentistry. And I think this is a terrific platform to allow that sharing of information, the sharing of knowledge, and the sharing of ideas without the restrictions that occur from either jealousies or concerns for someone else taking away your business.
And I think it's probably fair to say, based on what you were saying, that iADS is sort of a selfless organization. The ultimate beneficiary of all of this sounds like it's going to be the patient.
I certainly agree with that 100%. And that really feel should be our focus, is what is to serve our patients in the best manner possible. You know, that raises our, I guess it raises us to a different level that we cannot achieve by ourselves.
Dr. Moy, I want to thank you very much for joining us today. This has been the iADS Member Spotlight. I'm David Schwab, and we'll see you next time. Thank you very much.
Thank you, David.